The broadcast is now starting. All attendees are in listen-only mode.
Welcome to the webinar. My name is Cheryl Frischman from Littman Krooks, and today, for the next hour, we're going to be speaking about the Affordable Care Act and what it means for your special family. So what is the Affordable Care Act? We have some acronyms or different ways that it's referred to. The ACA is one, and Obamacare is another one. Now, the Affordable Care Act gets a lot of press, but its main purpose, and it was passed and signed into law on March 23rd, 2010, but its main goals of the law are to expand health insurance coverage to all Americans, to enhance the quality of that insurance, and while keeping costs low to both individuals and the states. And the law has been implemented in stages, and it's pretty much fully implemented. As of January 1st, most programs were implemented, but the small business requirements were given an extension to 2015. So by 2015, we should fully be in effect. Now, there's four main components of the ACA, the Affordable Care Act, and usually we hear about the individual mandate or the requirement that everyone have insurance and the health exchanges, but what we don't hear a lot about is some of the reforms and the Medicaid expansion that goes along with the Affordable Care Act. So there are four main components of the ACA. And they are health care reform, health care exchanges, individual mandate, and Medicaid expansion. And we're going to go through those one by one. So what are the health care reforms? These reforms include new provisions that limit what insurance companies can and cannot do. They include changes to the law with respect to getting coverage and what must be covered. There are 10 essential benefits that states must be sure to include, with equal coverage afforded to each. So any health insurance policy must contain the 10 essential benefits, and here they are. I'm just going to go through them, and we're going to speak specifically later down the road or later on in the webinar about the ones that apply or are of interest to people with special needs, but anybody that requires health care in general is going to need these 10 essential benefits. And so every plan must provide ambulatory services, emergency services, hospitalization, maternity and newborn care, mental health and substance abuse disorder services, including behavioral health treatment, prescription drugs, rehabilitation and habilitative services and devices, laboratory services, preventative and wellness services and chronic disease management, and pediatric services including oral and vision care. And just of special note, there are two categories that have yet to be extensively defined and also can have a tremendous impact and will have a tremendous impact on people with developmental disabilities and special needs. And one is mental health services, including behavioral health treatment. And another biggie that we don't hear too much about in the news is habilitative services, which has another triple star next to it. We do know that policies in general have rehabilitation services, but habilitative services or habilitation services, that is a new phenomenon to be mandated in all insurance policies. And we're going to talk about what habilitative services are and what's required under the ACA and in New York in particular later on in the webinar. So in addition to the healthcare reforms, we've set up healthcare exchanges. These are a one-stop shop for people to access insurance in their state. So they serve as a platform for purchasing insurance and screening for tax benefits and subsidies and screening applicants who may qualify for Medicaid. So it's not just a place to purchase insurance. You can also be screened for Medicaid eligibility on the healthcare exchanges. And we've heard a lot about the healthcare exchanges and the issues that we had with the healthcare exchanges. The launch was in October of 2013. Open enrollment just ended in March, the end of March, and open enrollment will begin again on November 15th, 2015, and run through January 15th, 2015. And we'll talk a little bit later about people that can even access the healthcare exchanges at any time and don't have to access them only through open enrollment. So there are 5 so in New York, our exchange is called the New York State of Health. And if you want to find the website for that, you can Google it, but I'll just give it to you real quickly. It's New York State of Health .newyork.gov. Again, New York State of Health .newyork.gov. And at the New York State of Health, you'll find 5 levels of insurance for sale. They all offer the same coverage, okay? So they can't take away any of those 10 essential benefits that we spoke about earlier. The difference lies in the amount one pays for the premium versus out-of-pocket medical cost. The higher the plan, the higher the premium, but the lower out-of-pocket cost. So these are the different qualified plans that you can apply for on the New York State of Health. There's a platinum, and gold, a silver, and a bronze, and they each have percentages that the insurance will cover of those 10 essential benefits. So there is, like I said earlier, some exceptions to open enrollment. These people can apply at any time during the year in the exchange. An individual who's eligible for Medicaid can go through the exchange at any time. An individual eligible for Child Health Plus can go through the exchange at any time. And American Indians, Alaska Natives can enroll at any time. I also just want to note real quickly that, I'm just going to go back for a second, that there is also a catastrophic plan that's available on the exchange for people under 30 that can't afford insurance at all. So also on the New York State of Health, you'll be looking for whether you can qualify, or an applicant for insurance can qualify for premium and cost sharing subsidies. So a premium is, how much you pay for that insurance, what that fixed amount you pay every month or yearly for that insurance is. Cost sharing is how much your out-of-pocket actually is. So that's screened during the application process, and it's based on the cost of a silver plan, and they look at your income in terms of screening for subsidies, both the premium and the cost-sharing subsidies. You can elect a higher premium plan than the silver plan, but the subsidy is based on if you had selected the silver plan. Now, just to give you some figures, just so you understand a little bit about who can qualify for premium and cost-sharing subsidies, the premium and cost-sharing subsidies start at, for a family of 4, 133% of the poverty level, which is about $30,000. Okay, so if a family of 4 makes $30,000, 2% of their income, or their income after all of the deductions that are allowable for their income, can go towards their premium. And The same for cost sharing. The insurance would have to pay for 94% of the out-of-pocket costs if they're a family of 4 has $30,000 a year in income. Now this premium and cost sharing goes all the way up to the 400% of the poverty level. So if you have a family of 4 that makes $88,200, and you can still qualify for premium and cost sharing subsidies. So a lot of people don't believe that they can qualify for these subsidies, but they really do go up. You don't have to be as close to the poverty level as you think to qualify. So you can go through the exchange, look at different insurance, and then put in your income, and it'll spit out automatically whether you can qualify for these cost sharing and premium subsidies, which are very helpful for people that have difficulty affording insurance. So in addition to the expansion of healthcare in general, the exchanges, there's also an individual mandate that the ACA provides. It requires that all people, all individuals, have minimum essential coverage. So the minimum essential coverage that you can get on the exchange by 2014. So these plans can be plans that are purchased on the exchange, employer coverage, grandfathered plans, which, are grandfathered in but will be obsolete at some point, Medicare, Medicaid, CHIP, VA coverage, etc. So you don't have to buy something through the exchange if you already have coverage through one of the other, through your employer or through Medicaid or Medicare, but you must have minimal essential coverage. So that's why a lot of people may have gotten some cancellation notices from their insurance you heard on the news, because maybe they had insurance that didn't meet those minimal essential coverage, which are those 10 essential benefits. So let's say that you don't do it. Let's say you say, I don't really care. I still don't want the health insurance. There is a penalty assessed to anyone who does not fulfill the mandate, and there's a calculation for that tax penalty, but the maximum penalty for a single family the maximum that a family can pay is set at $2,085. So the fourth thing that the Affordable Care Act does, and something that is quite intriguing to me because I don't think it's gotten the press that it should have, considering it's really a wonderful option for certain people, is Medicaid expansion. So the ACA not only expands health care coverage, gives us those exchanges, has the individual mandate, but also gives us the Medicaid expansion. So now, the Medicaid expansion is an optional program, so states can choose whether or not they want to expand. New York has elected to take part in the Medicaid expansion. So what does that mean for New Yorkers? It expands the pool of persons eligible for Medicaid to 138% of the federal poverty level, which means that a family of 4 that's at $30,000 of income would be able to qualify for Medicaid. Also, there's no resource test for this group. Old Medicaid budgeting rules would still apply, though, for those qualifying based on disability, blindness, or being over 65 years old. So we will talk about that in particular when we get to how it applies specifically for people with special needs, because we may have to go back to some of the old budgeting rules and not really look at this Medicaid expansion. So what do they look at in terms of determining whether someone can qualify for Medicaid? They look at your modified adjusted gross income. So like I said, a family of before can have $30,000 in assets. We're not looking at resources, just, $30,000 in income. We're not looking at assets. It's just income-based. We're not looking at resources or assets, just income. So the way that they determine the modified adjusted gross income is you look at the family's tax filing unit, and you include wages, Social Security, investment income, alimony, unemployment, taxable portions of pensions, IRAs, distributions, and annuities, and you deduct, there's certain deductions that come out of that, and you come up with a figure. So the new modified adjusted gross income eligibility groups are that can qualify under this. So that means that you can just go through the exchanges and apply and just have the income test, not the asset test, are pregnant women, infants, and children under 19. The new adult group that wasn't covered before are childless adults, which include individuals that are not pregnant, age 19 to 64, or 19 and 20 living alone, do not have Medicare, could be certified disabled, but don't have Medicare yet, parent and caretaker relatives, 19 and 20-year-olds living with parents, children in foster care, and if you're applying for Family Planning Benefit Program, FBPBP. So the groups that aren't part of this modified adjusted gross income group are still subject to the same old income rules and will still enroll, rather than enrolling through the New York State Exchange, through HRA DSS. And these are individuals eligible through blindness or disability, individuals 65 or older when age is a condition of eligibility, Medicaid spend down, Medicare saving people, and residents of adult home treatment centers and OMH residences. And there are some exceptions to this as well, but typically the people that would be applying for, let's say, long-term nursing home care, or people applying for services through OPWDD may not qualify to go through those exchanges and would not be part of this new modified adjusted gross income group. So how do you determine it, though? You can still go through the exchange. So if you don't have Medicaid yet, and you're thinking that you may require it or need it or could be eligible, you can go through the New York State Exchange at any time, because it's not closed off if you're applying for Medicaid, and put in your information, and it'll spit out whether you are eligible or not eligible. And what's very interesting about the exchange is that there's a new appeal system set up for Medicaid applicants and through the exchange. So for any application made through the exchange, including a Medicaid application made through the exchange, you have this hearing system that's run through the exchange. It's not the fair hearing offices that we're used to dealing with when we're doing Medicaid appeals. So there is a robust informal dispute resolution through customer service. There's conference opportunities, opportunity for hearing, and every denial determination will receive a notice of a right to appeal. So it's really a nice new system, and any of us that have dealt with fair hearing offices know that, look to anything as an improvement to that. So even though Medicare isn't one of the 4 things that the ACA has expanded, it did do in the law that was passed, it did close some loopholes like the Medicaid donut hole. They built in more preventative services, and what I think is really encouraging is that the ACA ensures the protection of Medicare for years to come. In the law, it states that the life of the Medicare Trust Fund will be extended at least through 2029, a 12-year extension due to reductions in waste, fraud, and abuse in Medicare costs, which will provide us with future savings and premiums and coinsurance. So it's really nice to know. We're always worried that there won't be a Medicare when we're ready to retire. Not that any of us will necessarily be ready to retire at 2029, but if you are, up to that point, we know that Medicare will still be there for us. So now that I've given you an overview of the ACA and what it is in general, I'm going to speak to you about what the ACA is and what it means specifically for people with developmental disabilities. So before we talk about what it does do, let's talk about what happened before the ACA was passed. So while exact numbers are not available for persons with IDD, and if you don't know what IDD is, it's intellectual and developmental disabilities. Some people refer to people with disabilities as people with intellectual disabilities and others with developmental disabilities. So it found that people with IDD specifically, there was a recent study that found that adults 18 to 64 with cognitive difficulties, 13.6% of them had no insurance, 32.1% of them had private insurance, and 41% had Medicaid, and 27% had Medicare. Now, those numbers may not all add up exactly because some people are dually eligible, but that's what it looked like. Prior to the ACA, many insurance plans did not cover or put a cap on certain services like speech, language and occupational therapies, mental and behavioral health care, rehabilitation and habilitative therapies, and certain prescription drugs. So sometimes a person with a cognitive disability, if they were able to even get insurance at all, were excluded a lot of the things that people with developmental disabilities needed if they allowed them on the plan at all. A lot of times, which we saw, and one of the reasons that the ACA was enacted is, sometimes, the costs would get prohibitive once the insurance companies realized how much or how many services the subscriber required, and may have even rescinded a policy because of an illness that a person had. So according to the American Health Insurance Plan Center for Policy and Research, over 20,000 children were denied individual health insurance policies based on pre-existing conditions, and over 18,000 additional children have individual policy issues, but restrictions were placed on their covered benefits. So like I just said, having any sort of pre-existing condition, whether it was a cognitive disability or any sort of health issue, would really knock you out of the ballpark, especially if you were applying for insurance on your own, and that left a lot of Americans uninsured. So how does the ACA benefit the community of people with intellectual and developmental disabilities? So the first way it does is it helps individuals with intellectual and developmental disabilities receive better coverage through private health insurance. So if you are an individual or have a child or an adult child or a young child with an intellectual or developmental disability, the ACA would help because it allows individuals, regardless of disability or pre-existing conditions, to access health care. And that is tremendous. It also prohibits annual coverage limits in health care plans in the insurance company. And we'll talk about what annual coverage limits mean. It doesn't mean that coverage is limitless, so we'll talk about that. It requires that benefit plans include rehabilitative and habilitative services and devices as covered as benefits. This is a tremendous asset for people with developmental disabilities, which we'll talk about specifically. Each one of these items I'll break down for you. And New York has also opted to provide autism coverage as part of their benefits offered in all plans, okay? So New York, in addition to those 10 essential benefits that we've spoken about, has opted to provide autism coverage, and we'll speak about specifically what autism coverage means, as a benefit. So let's say that the plan meets those 10 essential benefits. The autism coverage would be the 11th benefit, let's say, but there's other things that New York opts into, like chiropractic care and things like that, but it's in addition to the 10 essential benefits, which is pretty amazing because many of the states did not do that. So in how the ACA impacts current programs in New York, we'll talk about this a little bit as well. I'll break it down. The ACA, as we spoke about a little bit earlier, expands Medicaid eligibility. So we'll talk about possible groups of people with special needs or intellectual disabilities that may not have been able to qualify for Medicaid through OPWDD, but could maybe now qualify using these new modified adjusted gross income standards that are set up by the ACA. It expands Medicaid eligibility. It also expands Medicaid long-term care in certain areas for people with developmental disabilities. The ACA actually expands Medicaid long-term care in a lot of different areas, in the mental health arena, when you're dealing with elderly individuals as well, but specifically for people with developmental disabilities and intellectual disabilities, there is expansion in long-term care. And it also expands programs, Medicare programs that are available for people with developmental disabilities. So let's talk about, break down some of what these insurance companies, what's now being put in place for people with developmental disabilities and intellectual disabilities. So no longer can an insurance company deny coverage based on a disability or pre-existing conditions. What is a pre-existing condition? It's a health problem you had before the date that that new health coverage starts. So if you're applying for coverage and you have autism or Down syndrome or cerebral palsy and you put that on your application, they cannot say no. Okay? And your premium cannot be influenced by your pre-existing condition. Okay? And your eligibility cannot be influenced by your pre-existing condition. So those are huge for people that were struggling to get health insurance and who had cognitive disabilities of some sort and were just, you know, out of the game before it even started because they had a pre-existing condition. It also ends lifetime and annual coverage caps. So what happened in a lot of insurance cases with insurance, they would say, okay, well, you know, you have a lifetime limit on speech therapy. And once you reach that limit, you're dropped by your insurance. We're not going to insure you anymore. They can still cap individual benefits. For example, limiting the amount of physical therapy or mental health visits in a calendar year, but they can't say, okay, you've used up every single one of your benefits and now you can't be part of our insurance company anymore. So it ends lifetime and annual coverage caps. It ends rescission. Prior to the Affordable Care Act, many insurance companies found a way to drop expensive people by finding an error or omission on their original insurance application and using that as a reason to drop their coverage. So the individual can not only be responsible for their own cost of care going forward, but was sometimes held accountable for anything that the insurance company had paid. Under the ACA, rescission is no longer allowed. So an insurance company cannot take it back once they've allowed you to have coverage. A company can only rescind coverage in the instance of proven fraud. Now, just to clarify, all of these changes and these protections that are put in place are not just for insurance that you would buy through your exchange, the individual mandate and through the exchange. This was also for employer plans and other plans that you have. Now, no plans can do any of these things anymore. Your they can't rescind a policy. It ends lifetime and annual coverage caps, and you cannot deny coverage based on disability or pre-existing condition. In addition, it guarantees both the issue and renewal of insurance. You're going to get insurance. Now, New York has had this since 1993, but it is required now for the rest of the country. So this is a biggie as well. It does not allow insurance companies to charge different rates, different people, different rates based on health, age, or gender. So insurance can only base premium fluctuations on tobacco use, family size, and geography. And again, New York has had this provision in place since 1993, but now it's a federal law. So it also requires coverage of preventative care without charging a copay, coinsurance, or deductible. So a copay, if you don't know, is a set fee that is paid every time a service is used. Coinsurance is a percentage of the cost of a service which is paid by the insured. And a deductible is a flat fee paid out of pocket each year before the insurance will start paying. So if you go for your general checkup, there should be no copay, coinsurance, or deductible. So anything that's considered preventative would not have any copay, coinsurance, or deductible. It allows coverage of young adults on their parents' plans until 26. Now, New York has had a plan, has had a something in place for dependent children through the age of 29 if certain requirements are met. But now the ACA expands it nationally to 26. Now this is for a person or a young adult, whether they have disabilities or not. The option to expand your coverage or stay on a parent's plan come into play when a dependent cannot get private insurance by any other means. So if a dependent is still in school, in graduate school, and can't get insurance, they can stay on their parent's plan. This has nothing to do with disability. Now, in New York State, we actually can stay, if you have a child with a developmental disability or a cognitive disability, you can, and private insurers are also required to cover dependent, unmarried children, regardless of age, who are incapable of self-sustaining employment by reason of mental illness, developmental disability, or mental retardation or physical handicap, and who were disabled prior to the age of 19, as long as the employer still provides coverage through the family. So adults with significant disabilities who remain financially dependent on their parents beyond 26, beyond 29, in New York, if you're using the 29 rule, can petition to stay on their parents' plan beyond that age. It's really important that you look at the paperwork that you receive from your insurance company. You will get a letter, saying a dependent child, is going to be dropped because they've reached a certain age limit. If your child is disabled and meets the requirements, you can petition, which is not a seriously big deal to do that. You can petition for that child or that adult child with disability to remain on the parent's policy. I can't tell you how many parents don't know that this is an option and have missed, the opportunity for their child to remain on insurance. And one of the reasons why you would want to remain on your parent's insurance is because Medicaid is great. All right, and a lot of our children, I have a child with significant developmental disabilities that requires Medicaid, that fits the definition under OPWDD and fits the definition of Medicaid. However, Medicaid, while it provides and opens up tremendous opportunities for my developmentally disabled child, not all doctors take Medicaid. And not some of the doctors that I would want my child to see may not take Medicaid. For example, my son's name is Aaron. If Aaron, got hit, God forbid, by a car, or had some sort of accident and required some sort of plastic surgery, it's pretty difficult to find a plastic surgeon of, a very good plastic surgeon, someone that I would want to do cosmetic surgery, let's say, on my son that takes Medicaid, while I could probably find someone better on Aetna, which is my insurance policy. So it always is important to, if you can, and if you can afford it, of course, to keep your child on your private insurance in addition to Medicaid. Medicaid is always the payer of last resort, so the different people that you would see with your child, the different practitioners, different doctors, clinics, would bill your insurance first, and if they're denied by your private insurance, would then go to Medicaid as the payer of last resort. But again, this is a New York State rule, not an ACA rule, and I'm hoping that you guys that are listening to this webinar can get the word out that children or young adults with developmental disabilities can remain on their parent plan. Habilitative services. Now, this is such a great opportunity to receive services that we couldn't get before as parents of people with developmental disabilities or people, self-advocates with developmental disabilities. Historically, insurance companies have resisted funding non-restorative or habilitative services. Okay? So what does that mean? So rehabilitation we know about, right? Rehabilitation is, let's say I go to the doctor and I have a stroke, let's say. After I leave the hospital, I need some rehabilitative services to help me get back to where I was before. So to rehabilitate something or a rehabilitative service helps people recover what is lost, okay? And that's traditionally always been covered by health insurance. Habilitative services help you acquire new skills, okay? And this is not historically covered under insurance. So I could get speech therapy if for a limited, in New York State, for a limited time, at a rehab hospital, if I had a stroke and lost my speech, right? I could get OT and PT and speech because I once had it before, I had a stroke, and now I'm trying to get it back. But what about the kids like my son Aaron that really still need speech therapy? Just as part of having autism, he's still not speaking correctly, or he still needs OT or PT because he never had the skills. We're not restoring anything, we're gaining new ones. That's a habilitative service, okay? And that is now covered as one of the 10 essential benefits that you must provide in a plan under the ACA. Okay, but of course there's caveats to everything. The ACA requires habilitation coverage as an essential health benefit, but at this point leaves it up to the states to define. So how does New York State define? New York State define habilitative services. New York State defines it and they put it as a parity with rehabilitative services. So they're saying, look, we provide certain benefits for rehabilitation and we are going to do the same thing for habilitation. Okay, we're not going to give more, but we're certainly not going to give less, which is good news. Okay, so the nice thing is that New York State does not require, while it is aligned with rehabilitative services in terms of how many hours or the type of services that someone can get. With rehabilitation, you've got to have a hospitalization prior to getting services. There is no requirement that the services be post-hospitalization. So if you require habilitative services or speech services, OT or something to help you gain those skills, there is no hospitalization requirement. It can happen in an outpatient setting only. 60 visits per condition per lifetime. Okay, so that doesn't sound like a lot, right? Now, but it is, that's what the rehabilitative service benefit is too. So at least we have the parity. But it's 60 visits per condition per lifetime. So I'm just going to throw out there that a lot of our kids or people with intellectual and developmental disabilities have a lot of different conditions. For example, my son has autism, but he also has something called apraxia, okay, which is a speech disorder. Is that considered a separate condition? Can I get another 60 visits for that? My son has a ADHD, sensory processing disorder. I'm not sure. We haven't really seen this in action. So it's 60 visits total in terms of habilitative services, okay, which, it's 60 visits we didn't have before, so I'm glad. But actually separating out the different conditions may allow us to maximize the habilitative benefit in these plans. So just think about that. Again, I haven't really seen these in practice, but as I look at it, it seems that we should be able to really take each condition, break it down, and get habilitative services for each of those conditions, okay? And what's tremendous in New York, the habilitative benefit does not include treatment for autism, okay? In most of the other states, they include the habilitative service as, the autism service that a child or an adult with autism would require as part of the habilitative service. So if New York did that, you would get 60 visits per condition for autism. So if my son had autism, he would get 60 visits. In New York, it's an extra benefit autism, okay? Now, these initial requirements, and these initial definitions in terms of what an habilitative service is new. Okay, so, and we haven't really had an opportunity, people haven't really lobbied as much as I think they should have, and these are going to change, I think, and these were just the initial requirements that were put in place to implement the law, and it may be transitional in nature. So New York, did the easy thing, saying, look, we do 60 visits per condition for rehabilitation, so we're going to do the same thing for rehabilitation, but this may change. But remember that habilitation, is something most of us didn't have before in terms of services in our insurance plans, and it does not include treatment for autism. So let's talk about autism treatment. And again, this is not part of the ACA, but it's now an essential benefit that all New York plans have to have in place. So what is autism coverage? So this took in New York, this took effect on November 1st, 2012. The measure requires state-regulated health plans to cover a range of autism-related services, including ABA, up to $45,000 per year, with no limits on age or number of visits. And these are the different things that you can get through autism coverage. ABA, applied behavior analysis, behavioral health, diagnostic services, pharmacy, psychiatric, psychological, therapeutic care, assisted communication devices, the list goes on and on. New York has one of the most comprehensive autism insurance reforms in the country, requiring health plans to provide coverage of critical autism therapies for children and adults that are diagnosed with autism spectrum disorder. Shortly after the law was passed, There were emergency regulations which required ABA therapy to be provided only by licensed board-certified behavior analysts, and this left a lot of families, because there are a lot of BCBAs in New York State, without access to care. Actually, in New York State, there was no requirement in general that a child receive autism, ABA with a BCBA. It could be with anybody that's trained. But New York, in July 2013, emergency regulations were revised to allow BCBAs to supervise treatment. So as long as a BCBA is supervising treatment, you can get insurance coverage under the autism insurance law. An ABA, for a child with autism, why it is included as an essential benefit in the autism and coverage is it's the only scientifically validated treatment for the treatment of autism spectrum disorders. So New York is one of 24 states that requires autism on their exchange. New York does not consider these habilitative services, so it's not, this is in addition to the 60 visits that you would get under the habilitative benefit. There is a maximum of 680 hours, so there is some maximum, but it's pretty huge maximum per plan year of screening, diagnosis, and autism treatments and treatment of autism spectrum disorders. So the good news is that New York does not consider this habilitative, so you can take advantage of the habilitative benefit and get speech therapy through the habilitative benefit, but also get ABA under the autism benefit in New York. So that's pretty unbelievable. But as a reminder, this is not a replacement for school-mandated services, okay? Insurance-based services should only be used, insurance-based services should not be used to replace school-based educational interventions. Many children with autism will receive similar services such as ABA and speech therapy in school. These are focused on academic skills, and at home focused on habilitative or life skills. Insurance companies may not require copies of the school IEPs, and schools may not require copies of insurance treatment plans. Okay, so a school district cannot say, look, I'm not going to provide this for you anymore because you can get it through insurance, and vice versa. The insurance company shouldn't say, well, since you're getting this through school, I'm not providing it. Okay, now, if a service is not determined appropriate by the school, ABA, for some reason, then you can turn to your insurance company to get those services. So we're going to go through this quickly because we're running out of time. Medicaid, in addition to all these great things that we get in terms of habilitative services and ending rescission and pre-existing conditions and the autism insurance as an essential benefit. Medicaid in general is made more accessible and more comprehensive, as I said earlier. New York has opted into the Medicaid expansion, so now 138% of the federal poverty level is the income amount for childless adults. So there's a new method of determining income, which we talked about in the first section, and there is no asset test, okay, for these new beneficiaries, okay? The government estimates that 16 million new beneficiaries will receive Medicaid by 2019. Okay, so this is, this can really open up a large amount of people that could not access Medicaid any other way. So there is a new adult group, the childless adults. So where I see this really coming into play for people with developmental disabilities is that this may really open up for adults who are not OPWDD or SSI eligible, but have disabilities, are poor, and require insurance. These people may now be able to go through the exchange and access Medicaid. We do a lot of times see in our practice higher functioning individuals that that really, their IQ is too high, and it's really difficult to get OPWDD services or Medicaid through OPWDD or SSI. This new modified adjusted gross income group of childless adults may really open up opportunities for that group in particular. Again, though, the groups that are not eligible for this new resource income test are the people that previously received services or would continue to receive services under OPWDD. And quickly, something also not spoken about too much in terms of the ACA and long-term care for people with intellectual and developmental disabilities is the expansion of long-term care. There was a Supreme Court decision, Olmstead, that held that unnecessarily placing people in institutional settings who could be cared for in the least restrictive setting is a violation of the American Disabilities Act, and there are financial incentives made possible by the ACA that are in line with Olmstead that New York has opted into. One is, and we're not going to go into great detail about this because we're running out of time, is money follows the person. This is a new, well, it's not so new, but there's more money in it now through the ACA. New York has opted in, and New York OPWDD, Office of People with Developmental Disabilities, is participating in this money follows the person that's expanded through the ACA, and hopes to transition 875 individuals into the community, into community settings by 2016 using Money Follows the Person. So people who are still in state-run institutions, there are still people in those institutions, people that are living in more restricted housing than they should be or receiving more restrictive services will be brought back into the community through Money Follows Their Person expansion that the ACA gives us. There's also the State Balancing Incentive Program, BIP. This has allowed New York State to set up some new systems for OPWDD. This is allowing that single point of entry system that we now have. They're trying to use BIP money to provide the most cost-effective community-based service cares and supports in the least restrictive non-institutional setting. So New York State's opted into this, and OPWDD is using it to come up with a plan to get more people's services in a more cost-effective manner. And if you're interested in learning more about this, you can go on the OPWDD website and find out more information about it and BIP and OPWDD. Community First Choice is going to be something amazing. We don't have it yet in New York. New York wants it. But this is something that would allow people to stay home and get community-based attendance services and supports as part of their Medicaid plan. These services would be provided for people of any age and any type of disability who would have gone into an institution if they didn't receive these services. So this would allow people to remain in their homes and get all sorts of services, or remain in the community and get all sorts of services. And these would be assistance with ADLs, management for shopping and food, all health-related tax and attendance services. New York State wants this money and has been trying to utilize it, but they can't because there's been a big holdup in New York State because the nurses union has opposed this option because in order for New York State to be able to fully implement this option, we need the nurses to be able to delegate to non-RNs. And nurses feel, I guess, that by passing, they don't want to lose business, I guess, and they don't want to delegate. They want to keep it for themselves. However, there's not enough RNs to go around, and it's not cost effective. Now, so CFC was not able to be put into this year's budget. Now, as far as I could tell, on April 1st, the nurses had, using under pressure, had changed their provision and allowed delegation, and that Governor Cuomo was excited and was going to submit language to the Assembly and the Senate that would establish nurse delegation and fully implement the CFC option. But I just looked, and now the nurses union seems to not have done that. So look out for more info on this. And this really is something great that we in New York can take advantage of. So if it's something that interests you, or if it's something that you think would be of interest to your child or someone you work with, it wouldn't be a bad idea to write to your legislators and get this nurse delegation thing fixed so we could fully implement CFC in New York. There are a ton, and I mean, I could talk for hours. I did a presentation recently, and it was 2 hours on the ACA and what it does for the IDD community. So there's tons of provision. One of the things that it does that we didn't mention, though, that I think is very important, is that it does also improve data collection about people with disabilities. So that should help us in terms of, understanding how many people we have in our cohort of people with autism, people with Down syndrome, people with cerebral palsy, so we can get research in those areas as well. So there is so much. Okay, the ACA is a very, very comprehensive law. It includes so much more than just health exchanges and the things we're hearing on the news, as you can see. There are numerous other provisions, even more than the ones that I discussed, that expand the healthcare workforce, make changes to existing programs, test new ways to pay for healthcare services, and other provisions affecting people with disabilities that were not discussed in this presentation. But stay tuned, and thank you for attending today. Do we have any questions?
We do. How many do you want to take?
Well, how much time do we have?
Well, it's 1 o'clock now.
Okay, I can take 5 minutes of questions because we started late.
We had a question about whether an iPad is covered for a child under the ACA.
It could be covered under the autism insurance provision. And you could go through your insurance and ask that it be covered. Assistive technology is something that is mentioned. Again, you may want to look at your school district as well, because if it's being used for educational purposes, that would be the school district's responsibility. If it's going to be used as something for non-school purposes, just, at home, and to make things more accessible. If it's a required provision, you'd have to have a prescription from a doctor saying the child requires it, and what software the child would require, then it could be covered under the autism insurance, yes. But again, it's going to kind of be difficult because there is this school day, it makes up a lot of your day if your child is under, I guess, the age of 21. And an insurance company would argue that if it's being used to navigate school, that it's the school's responsibility. So you could get caught up in that, but it is possible.
Okay, did a private insurance or Medicare deny coverage if proper documentation is provided?
Private insurance?
Yes.
Provide coverage for what?
The iPad. This goes back to the iPad.
Oh, for the iPad? If proper documentation is put in place, then they shouldn't be able to deny coverage. One of the things that I would ask to do is for you to go to your insurance company and ask for their autism benefit. Now remember also that when you're talking about autism insurance and these ACA insurances, we're talking about private insurance. We're not talking about all insurance. For instance, if you are getting your insurance through, like, let's say UPS, it's a big company, then they are a grandfathered in plan, and they may not have to provide the autism benefit just yet. IBM, some of the larger companies that provide their own insurance. So just realize that. So what I would do is, if you're not, or even if you are part of that group, say, what do you provide in terms of autism benefit? And they should tell you, and assistive technology should be in there, and they should tell you what you need to provide in terms of documentation, and if you provide that documentation, it should be okay. Again, though, remember, it doesn't have to be the best. Just like in any insurance company, you can ask to go see the best doctor in the world, but if they're not on the plan, they may not provide, they're not going to let you go to that doctor. They're not going to pay for it. They may say, an iPad is too much. Maybe we would get some other sort of device. And again, if it's needed during school, an insurance company is going to be hard pressed to provide that they won't provide it for educational, just medical.
Okay. Here's another question. I was told the ACA required giving up private insurance in order to get Medicaid.
No.
Did people hear that?
Okay, the question was, again, what's the question?
I was told that the ACA required giving up private insurance in order to get Medicaid.
Okay, the ACA does not require giving up private insurance to access Medicaid. What it does do, though, okay, if you have private insurance, okay, that is not aligned with the 10 essential benefits, okay, and now you're in this group of people that make, let's say, that $30,000 a year for a family of 4, you would get Medicaid and you would probably not get the individual insurance. You get Medicaid through the exchange. Like I said before, there is no requirement that you give up one for the other when you have a child with a developmental disability. You can keep the private insurance that your adult child or minor child on, even if they're on Medicaid in New York State.
Okay. One question. This might be the last one. This is quoting the question. So the 60-visit limitation does not apply to autism classification. Is it unlimited?
Okay. Well, the 60-visit is does not apply. It does apply to the autism, not classification. Classification is a education term. Diagnosis. Okay, no, you could use it under the habilitative benefit, but why would you? Because you get the extra stuff from the autism benefit. But let's say your child has a disorder like apraxia or something like that that needs specialized speech therapy that wouldn't be provided under the autism benefit. You could go through the 60 visit under the habilitation benefit. Again, the autism benefit is capped at $45,000 a year for ABA and 680 hours per year of all services. I mean, I would go through the autism first if you have a child with a medical, again, we're talking medical diagnosis of autism. Classification is a school term. Okay, the PowerPoint will be available online, and this presentation, the PowerPoint will be available online on our website if you need it. No? Okay.
Okay. For people wanting the PowerPoint, we'll email it out to people that request it. So if you'd like the PowerPoint, please email.
Yes, please email. Should we give out your email?
I think they'll have an email here.
Okay. All right. Whatever email you signed up for the presentation for. Thank you so much for joining us today, and I hope you learned a lot. It's a lot of information to cover. And again, on behalf of Littman Krooks, thank you for attending this webinar today. Thank you.
You muted? Mute yourself?
You muted, and I'm going to sign off.